Dr. Bingham, will you give me a demonstration of this machine? I know you have, it's a 3D machine that takes a scan of what exactly?
Well, we'll show you a scan. We'll take a three-dimensional scan of a root canal.
Okay.
So right now we have Haley standing here, and we'll get a chance to show you how this machine works. And I'll step over here and grab this.
Grab this thing that takes the picture.
And I'll stand here with it. I usually don't stand here by them while we take
because that's low radiation, right?
But we have an amazingly machine. It's amazing is that the new technology has made it so that the radiation is so minimal. So listen to the machine and watch it go around, and Haley will be just smiling when she comes out of here. Here you go. Here we ready? What it's doing now is taking a bone density. It's checking to see what. It'll automatically check the bone density, and because she has the bone density that
most of us envy.
Then it will tell us and take a more ideal X-ray and decrease the radiation to only what she needs.
Now she's going to step out of it now.
She'll step right out of it. She's let herself out of it. She knows how to do this.
Uh-huh.
We'll let this hang that back.
This also helps with, you also teach some classes here for dental hygienists, right?
No, not dental hygienists, but dental assistants. Dental assistants. What we have a class here that meets, we have 4 classes a year, and we have, after I leave the office, they take over and teach night classes where they teach dental assistants. And we teach them the skills on how to take X-rays, how to read.
So how to read these X-rays right here. So what are these X-rays of exactly?
What we have here is a 3-dimensional X-ray of a tooth that needs that's having a failed root canal, and particularly this screen here has to do with a longitudinal view of it. This is a cross-sectional view of it, and this tells where it sits in the plane of the mouth. And so we have a chance, and I can turn that tooth in 360 degrees and look at it from all different directions.
So how does that help in the advance of dental, I mean, how has it helped you as a dentist with these 3-dimensional X-rays?
Well, what I have right here is, for instance, this one right here. If I click on this and turn this, no, it's not going to turn for me. Excuse me, let's go back to this. I'll have to change this thing right here. We're going to gather a little information. It'll allow me to do some things here that now I can turn it. Volume rendering. Okay, so what this tells me as a doctor is that this tooth particularly has a curve in the root.
Okay.
This curve can be problematic or it can be treated. So in order to, this curve will turn this direction, and it'll come back here, and it'll turn back this way. Okay. So can we treat that? This tooth has been treated, and it's not working right now. It's failing. This bone is being lost right here. So now I'll take and turn it around and see what kind of a bone loss we have. And by rotating this tooth around this way, I can stand it on this edge this way, and I can see over here what's happening to the roots here. Do we have 2 or 3 different roots? Do we have a crack or a fracture?
So with normal X-rays, you wouldn't be able to see that?
No, on the normal X-ray, we would only see. I don't have a normal X-ray right here. I should show you.
Yeah.
But a normal X-ray, all we see we'll just see this stacked on top of each other, and you'll take this picture from this side, and we have no idea if one of them is turned, one of them is straight.
So it helps a lot with root canals for sure.
Yes, and so the same thing if we extract that tooth, which what we have done. Mm-hmm. Now we're going to put an implant in here. How close can I get to this sinus? What does this sinus look like?
Yeah.
And so as we look at those dimensions of the sinus, can we get close there? Do we have to graft it? Do we have to lift the sinus? Those kinds of things.
Very important when you're dealing with someone's sinus cavity.
Right. So anyway, by getting better information, can we offer you better treatment? Can we give you something more secure, more sure? The outcome.
The answer is yes.
Yes.
Definitely here
yes,
with this 3D machine. And you're maybe one of the few that have it, other than maybe the hospital or other
yes,
people.
we have. It's a fairly expensive piece of equipment, and because of that, they're fairly rare. And so we invite people to come. Your dentist can also refer you here for these kind of things. You don't have to just be a patient of ours to have this information given to you. So our office is located at 120 West Cache Valley Boulevard.
Bingham Plaza?
Bingham Plaza, 2-story building. We're on the 2nd floor. Just turn west at Sizzler. That's 1250 North, and you'll see our building.
Perfect. Well, thank you so much, Dr. Bingham. Appreciate you and the new technology you have here. And wherever Haley ran off to, we'll thank her too.
Thank you.